Vina says that why do sickle cell patients have so much body pain and what can be done to treat their pain? And actually, this question came in earlier from one of our parents as well. She was also saying that what exactly is happening to the body when a sickling positive person is said to be having a crisis, and how does a lay person handle the situation? So why do they have pain? And if you're a lay person, what can you do to handle their crisis, including the pains?
So the first thing is to recognize that the child has pain. We always presume that, oh, children, they are very tolerant. They don't have pain. They can tolerate as much as pain as they can. We adults are the ones who always are intolerant to pain. It's a myth. Children do have a lot of pain, and that pain has to be respected and treated appropriately. That's number one. Recognition of pain is very, very important. And children who are pre-verbal, especially below the age of 6 years, they will not be able to express where exactly the pain is. So all you would see that is the child would be fussy, would not be feeding well, would refuse to move a part of the limb, and so on, or just non-specific. They cannot actually express and specify where exactly the pain is. So it's very important to assess that, okay, something could be wrong, and this could be because of bone pain. So what happens when a child has pain is that there is a possibility of acute or an increased rate of sickling of red blood cells, either at one part of the body or multiple parts of the body, that causes reduced blood supply to that part of the body. And that can lead to something called reduced oxygen supply, and that's when the pain starts. And it's very difficult to recognize at the early stages. Usually when there's a particular amount of intensity of the pain is reached, that's when people tend to manifest external symptoms. And the first thing after a parent or a caregiver has recognized is to see or place the child in a position of comfort. It is not the time to make the child, if the child is comfortable keeping the leg bent or knee in a particular position or hand in a particular position, this is not the time to say, hey, come and lie down, stretch your arms, stretch your legs. No, that's the position of comfort for that child. So that's the first step. Second step is to provide a lot of hydration. So when I say hydration, water, juice, coconut, preferably non-sugar drinks, so that's the thickness of the blood would be a bit diluted. So improve the child, encourage the child to drink as much as the child can tolerate so that the blood becomes thinner and flows better. And then start giving pain relief medications. People should not shy away from giving medications, especially thinking, oh, it will become a habit. No, every child's pain should be respected well, and that child deserves that pain to be ameliorated. So it's very important to start pain relief medications such as paracetamol, ibuprofen. And once the pain relief is not satisfactory after certain time, say 6 hours, 8 hours, and usually this child gets a pain relief within this stipulated time and still it's not getting better, that's the time that you start moving the child to the nearest hospital. And there's also a role,
thank you so much, Sudha. You said
I just want to add that there is also a role of non-pharmacological measures. You can do compresses where the pain is, and distraction techniques also help children from getting rid of pain.
Okay.